etc.
Doctor, what is Meniere's disease?
In a Meniere's disease, the endolimb and perilimb liquids inside the cochlea tends to mix up together at different parts of cochlea depending upon the pressure inside, and which causes the vertigo, tinnitus, hearing loss, and sometimes vomiting also. Okay, naturally a Meniere's disease is a condition which the patient tends to have a sudden hearing loss in most of the cases. Patient will be complaining about the tinnitus. In a Meniere's condition, if you see this graph, the 250 Hertz area of the audiogram tends to be in a much lesser level, which is supposed to be the highest level of any person's normal person's hearing capacity is concerned. What happens? The 250 Hertz in an audiogram is lying below, say for example at 60 decibel, whereas the sound from very far distance, say at for 4000 Hertz and 8000 Hertz, is hearing at 20 decibel itself. When the sound is uttered from very near, he is able to hear only at 60 decibel, whereas if it is from very far distance, the person is able to hear at 10 or 20 decibel itself, which means something is suspicious. Okay, so these conditions is called Meniere's disease. It is treatable condition. Okay, in a Meniere's condition, the patient is advised not to put hearing aids at all, no tinnitus maskers at all. The persons with the tinnitus masker, Meniere's disease, should not sit in a giant wheel or other movements which is causing a circular movement in a centrifugal way, etc. That what happens, it will mix further the endolimb perilimb inside the ear and makes further loss. Okay, so these type of things has to be avoided. We have some instructions for Meniere's disease in our website, www.srigiri.in.
Why spinning head or vertigo develops? Can such patients wear hearing aids?
We have already said that in a Meniere's disease, the lesion happens, the endolimb and perilimb both tends to get mixed. When such a lesion is happening at different areas of a cochlea, the person tends to get a reduced liquid level in the semicircular canal area of the cochlea, which is actually maintaining the balance system of our body. Usually the head rotation from upper to down or from sideways or been slanting, the entire movements is being controlled by the cochlea. The balance system is maintained by the cochlea. When that liquid is being reduced, naturally a person is going to get the vertigo. Okay, when the pressure is much more higher, when the lesion is much more higher, the possibility of creating a third window is also possible in the condition like the round window and the oval window. In addition to the round window or oval window, there will be a third window in the superior part, semicircular canal. In that area, the window tends to open up, and there are some solutions available naturally for those things, and there are some solutions available through surgery for those type of third orifices. Those type of patients who is having a third window in the superior semicircular area tends to hear their own heartbeat sound. Okay, even they will be much more frightened to their own voice also. Sometimes even a click sound or a very small sound tends to get irritated. The patient will be irritating to much bigger level for a very small sound. Okay, in a condition called SSD. Okay, so try to treat Meniere's disease or any tinnitus condition to prevent a condition to become a SSD.
Persons with vertigo or tinnitus are advised not to use tinnitus maskers or hearing aids. Why, doctor?
The person who is having a tinnitus or a Meniere's disease or SSD should avoid using hearing aids because I have already said that these three things happens due to the lesion in the cochlea. Okay, it is of no use by putting a chili powder over a wound and expecting the wound to heal. Okay, likewise, if you keep on putting much higher force into the cochlea, to the cochlear, by keeping a hearing aid or tinnitus mask in the ear canal, naturally the force will be much more higher, that would eventually destroy the residual hearing capacity. Okay, so tinnitus masker or tinnitus pure tone sounds or any hearing aids or even a headphone is not allowed to be used for particularly a person of a tinnitus or hearing aids.